Good day, everyone. Thank you for being here. Today, I want to talk about a target that's both audacious and urgent. Over the next 20 years, my goal is to give away virtually all of my wealth. That means more than $100 billion deployed across causes that matter most: global health, education, clean energy. It's not just about the total, it's about the timeline. This isn't tomorrow, it's right now. There's a question I return to often. If you're fortunate enough to have resources, knowledge, and time, what do you do with that good fortune? For me, the answer has become increasingly clear. You use it. You deploy it. You put it to work in the most meaningful ways possible, not later, not eventually. Now, because the urgency of the challenges we face doesn't leave room for hesitation, and because meaningful change isn't the responsibility of a few, it's a collective effort. I may have more capital to move at scale, but the spirit behind this giving, this commitment to solving big problems, that's something anyone can share in. The idea that giving is just for billionaires misses the point entirely. What actually changes the world is a network of thoughtful actions, teachers mentoring students, scientists publishing open research, everyday people supporting local health clinics, small foundations funding local clean water projects. When we put our values into action, whatever our means, we participate in something much larger than ourselves. It's not the size of the gift, it's the direction of intention. When I first started this journey, it felt a little abstract. You read the statistics, the number of children dying before age 5, the millions without access to clean toilets, the students dropping out due to poor school infrastructure, and then something shifts. You visit a clinic. You speak to a mother who lost a child to something entirely preventable. You meet a girl who's walked 6 miles for drinking water since she was 7. Suddenly, the data becomes a face, a story, a human life. That's when the mission becomes non-negotiable. That's when you stop asking, should I help, and start asking, how can I do more? I'm aware that I have a unique platform, but having a platform and using it are two different things. I've seen firsthand how ideas that seemed smallness, keto nets, solar, powered fridges for vaccines, mobile banking, grew to transform millions of lives, and they did so not just because someone had money, they did so because people collaborated, engineers teamed up with nonprofits, governments partnered with researchers, volunteers translated reports, donors funded the risky first steps. Real impact is always the product of shared effort. There's a notion that philanthropy is a kind of side project, something you get to later, but I've come to see it as something central, something urgent. Especially in a time when innovation is moving fast, we have an opportunity and a responsibility to direct that momentum toward the people who need it most. The truth is, the future doesn't just happen, it's built with intention. It's shaped by the decisions we make today, the priorities we invest in, and the people we empower. So when I talk about giving away my wealth, I don't just mean dollars. I mean giving focus, energy, and a long-term commitment to seeing things through, because the hardest problems are never solved overnight. Progress is uneven. Setbacks are part of the process. But what matters is persistence. What matters is that we don't give up because a challenge looks complex or far away. In my experience, the most powerful progress happens when we keep showing up, even when the cameras are off, even when the story fades from the headlines. We all play a role. Whether you're an entrepreneur thinking about sustainable business, a student exploring the impact of AI, or a parent talking to your kids about the world beyond your neighborhood, you're part of the equation. The world gets better when more of us care, more of us contribute, more of us believe that change is possible and worth working for. If there's one thing I've learned, it's that we underestimate the ripple effect of committed people working together. You don't need to solve every problem to be part of the solution. You just need to start where you are with what you have and ask the right questions. Who can I help? What systems can I improve? What ideas can I amplify? This isn't about charity. It's about justice, about human dignity, about using what we have, whatever it is, for something that lasts longer than we do. I believe the next 2 decades are an inflection point. The decisions we make now, the partnerships we form, the innovations we champion, they will shape what kind of future we leave behind. And while I may be setting a deadline for myself, the real invitation is for all of us to join in, not just to imagine a better world, but to help build it, starting today. When I think back on my life, I see a series of transitions, some expected, others completely surprising. One of the most profound transitions wasn't stepping down from Microsoft or navigating a new chapter in the tech industry. It was realizing that the next chapter of my life needed to be about more than software. It needed to be about people, about applying the same curiosity, problem solving, and determination that drove me in business to the world's most urgent human challenges. That realization didn't happen overnight. It came gradually. At first, I was still immersed in the mindset of building and scaling systems, always looking for the next breakthrough, the next opportunity to solve a technical problem in a new way. But something shifted when I started reading deeply about health inequities, about children dying from diseases that had been virtually eliminated in wealthy countries, about farmers unable to grow enough food because they lacked basic tools and knowledge, about girls being denied education because they happened to be born in the wrong place. I wasn't just reading statistics. I was seeing opportunity. I was seeing problems that could be solved if we approached them with the same kind of commitment and focus we bring to any grand challenge. I'll never forget reading about rotavirus for the first time. It was responsible for hundreds of thousands of child deaths every year, and there was already a vaccine. Safe, effective, proven, but in many of the poorest countries it simply wasn't available. The barrier wasn't science, the barrier was distribution, cost, and political will. That stuck with me because it showed me that sometimes the distance between a child living or dying isn't about whether we have the solution. It's whether we care enough to make sure the solution reaches everyone. That idea was impossible to unsee. Around that same time, I started traveling more, clinics, schools, research labs, rural villages. I met people who were doing extraordinary work under difficult circumstances. A nurse in India who walked door to door administering polio vaccines. A mother in Senegal growing her own vegetables for the first time with the help of a local women's collective. A teacher in Kenya building a science curriculum from scratch because her students didn't have textbooks. These people weren't waiting for permission. They were creating change every single day, and I realized that the best thing I could do wasn't to reinvent the wheel. It was to support, scale, and accelerate what was already working. My role could be to help take good ideas and help them reach more people faster. That changed how I thought about my time, my priorities, and my purpose. I started to see giving not as something separate from my work, but as the most important work I could do. I wasn't stepping away from building things, I was just building something different. The goal wasn't shareholder value anymore, it was human value. It was figuring out how to use the tools I had: capital, connections, knowledge, and experience, to give more people a fair shot at a healthy and productive life. There's something very humbling about that shift. In the world of business, you get used to measurable returns, to control, to predictability. In the world of global health or education, the impact is real, but it takes longer, it's more fragile, and it depends on so many people working together. And that's part of what makes it so meaningful. You're not just optimizing a process. You're investing in people, in communities, in futures that wouldn't have been possible otherwise. Looking back, I realize that I was lucky to have the space to make that shift. But I also believe that anyone, at any point in life, can ask a version of that same question: what matters most? Where can I have the most meaningful impact? For me, the answer became clear over time. It wasn't about chasing new milestones of success. It was about redefining what success even means. not in terms of wealth, but in terms of lives improved. Opportunities created, suffering alleviated. That's why I've committed the rest of my life to this work. Not because I have to, not because it's expected, but because once you've seen the power of targeted generosity, once you've seen a child vaccinated, a classroom lit up with solar energy, a farmer using better seeds, you can't look away. You feel a deep sense of responsibility, and more than that, you feel hope. Hope that with the right investment, the right partnerships, the right sense of urgency, we can solve problems that once seemed permanent. That hope continues to guide everything I do. It reminds me that even though I come from a world of ones and zeros, this next chapter is about something more profound, making sure that opportunity and dignity aren't determined by where you're born, but by our shared willingness to act. A few years ago, I visited a rural health post in northern Nigeria. It was a modest building, concrete walls, tin roof, packed earth courtyard, but inside something extraordinary was happening. A nurse, working with very limited resources, was using a small handheld device to scan pregnant women for complications. The device looked like a smartphone, but connected to it was a low-cost AA-powered ultrasound probe. It didn't require a full hospital setup or a team of technicians. It was portable, battery-operated, and it worked. One of the women being scanned that day had walked more than an hour to reach the clinic. She had been feeling pain but wasn't sure what it meant. The scan revealed that her baby was in a breech position, a complication that, without proper care, could be fatal during delivery. But because of that simple scan, the nurse was able to refer her to a better-equipped hospital in time. That one moment in that one room may well have saved 2 lives. That's the kind of quiet miracle that's happening all over the world when the right technologies are placed in the hands of the right people. Not in high-tech labs or private clinics, but in community outposts like that one where innovation meets intention. It's a perfect example of what's possible when we shift our focus from complexity to accessibility, when we stop asking, how advanced is this tool, and start asking, who is this tool reaching? What struck me most was not just the device, it was the ecosystem that made it useful. There were community health workers who knew how to earn trust in local villages. There were NGOs who trained midwives to use the device properly. There was a government supply chain making sure that the equipment could be delivered and maintained. Each part of the system on its own wasn't enough, but together it was a solution. That's how meaningful progress actually happens, not through isolated breakthroughs, but through systems thinking, through local partnerships, through humility. Understanding that local knowledge is just as important as global resources. I've seen the same pattern repeat itself in many places. In Tanzania, where simple text message reminders increased vaccination rates. In Bangladesh, where a flood-resistant latrine design kept sanitation infrastructure working even in monsoons. In India, where digital ID linked people to government benefits they had been excluded from for years. These are not high-cost, high-glamour stories, but they are the foundation of real, durable progress. The ultrasound device in Nigeria reminded me that innovation doesn't have to mean cutting edge. Sometimes the most powerful technology is the one that removes barriers, not the one that dazzles, and it also reminded me of the importance of listening. That project only succeeded because the people designing the solution talked to midwives, not just engineers. They asked what was actually needed, and then they built something for that need, not for the patent, not for the headline, but for the mother standing quietly in the doorway, waiting for news about her baby. It's easy to get caught up in scale, in numbers, in the sweeping ambition of solving global problems, but when you see a solution work at the level of one person, it reframes everything. You stop thinking in abstractions, you start seeing faces, names, families, futures, and suddenly the stakes feel different. You realize that every statistic you read, every million in a headline, is made up of individual moments just like that one in the clinic. That's what keeps me going, knowing that real lives change when smart ideas meet local action. knowing that we already have many of the tools. We just need to ensure they reach the people who can benefit from them most. That's the challenge. And it's also the opportunity to take what works and make it available everywhere it's needed, not as charity, but as a shared commitment to fairness, to dignity, to life. I left that clinic feeling hopeful, not because the problem was solved, but because the path forward was clear. It's not about waiting for the next big invention. It's about supporting the quiet revolutions already underway, the ones driven by nurses, mothers, field engineers, and community leaders, the people who are doing the hard work of making progress real, one scan at a time, one life at a time. One of the things that gives me the most optimism today is the pace of innovation, and not just in one sector, but across so many areas that matter for human well-being. It's easy to miss this if you're only following the headlines, but beneath the noise, the breakthroughs are piling up. We're seeing remarkable progress in everything from vaccines and diagnostics to agricultural technology, energy storage, and AI-powered education tools. What makes this moment so powerful is that we're not just inventing new things. We're finally figuring out how to deploy them at scale for the people who need them most. I've always believed that progress comes from a combination of optimism and realism. You need to be grounded in facts, because the world's challenges are complex, but you also need to believe that those challenges can be solved. Innovation gives us that belief, not blind faith, but informed confidence. When you look at what's been achieved in just the last decade, you start to see a pattern. Problems that once seemed immovable are starting to shift. Childhood mortality is down, access to clean energy is up, connectivity is reaching remote corners of the globe. It's not coincidence, it's the result of intentional investment in ideas that work. Take agriculture, for example. In many parts of sub-Saharan Africa, farmers are now using satellite data and machine learning tools to make better decisions about when to plant, how to irrigate, and what to harvest. These aren't theoretical tools. They're being used by smallholder farmers with a single acre of land. That's transformative. It means higher yields, more income, better nutrition, and it's only possible because of innovations that make data not just available, but actionable at the village level. Or look at energy. Battery technology has improved dramatically. The cost of solar power has dropped by more than 80% in the past decade. In places where there's never been a stable electric grid, we're seeing microgrids and pay-as-you-go solar bringing light and refrigeration to homes and clinics. This changes everything, from the ability to study at night, to the ability to store vaccines safely, to the ability to run a small business. Energy isn't just a utility, it's a foundation for opportunity. And thanks to innovation, it's becoming more accessible than ever before. One area I'm particularly excited about is AI in healthcare. We're seeing tools that can read chest X-rays with astonishing accuracy, detect diabetic retinopathy in early stages, and even predict outbreaks based on environmental and population data. These tools don't replace doctors, they extend their reach. In places where there may be one physician for thousands of patients, AI can be the difference between timely treatment and no treatment at all. And as these tools become more affordable and user-friendly, their potential only grows. But innovation isn't just about the tools, it's about the systems that support them. The real test is whether we can integrate these breakthroughs into the lives of people who have traditionally been left behind. That's where policy, infrastructure, and community engagement come in. It's not enough to invent a better solution. We have to ensure it reaches people in a way that respects their context and empowers them to use it effectively. That's why I remain so focused on partnerships. Governments, nonprofits, entrepreneurs, each has a role to play. When we align around a common goal and coordinate our efforts, the results can be extraordinary. What gives me confidence isn't just the science, it's the people behind the science. The researchers working late hours in labs funded by a patchwork of grants. the local health workers adapting global tools to meet local needs, the young technologists coming out of universities in Nairobi, Bangalore, Sao Paulo, solving problems their communities face every day. Innovation isn't limited by geography. It's powered by human ingenuity everywhere. I've seen how quickly things can change when the right idea is given the right support. That's why I'm committed to accelerating innovation not just where it's easiest, but where it's needed most. We don't have to wait for a distant future to begin solving big problems. The tools are already here, or they're close. What matters now is how we apply them, with focus, with humility, and with urgency. This is not a time for pessimism. It's a time for confidence, the kind of confidence that comes from evidence, from experience, and from seeing what's possible when we don't accept the status quo as unchangeable. The work ahead is difficult, but I've never been more certain that progress is not only possible, it's within reach. When I look at the world today, I see things with startling clarity, the enormous progress we've made, and the staggering distance we still have to go. The data paints a vivid picture of both. On one hand, global poverty has been cut in half in the last 2 decades. More children are in school. Fewer people are dying from preventable diseases. On the other hand, progress has slowed in critical areas. Climate change is accelerating. Millions still live without basic sanitation. Food insecurity is rising again in places we thought were improving. And what's most striking is how avoidable so many of these problems are if we act fast and if we act smart. That's why I keep coming back to data, not because numbers alone are inspiring, but because they give us a map. They tell us where the need is greatest, where the interventions work best, and where our dollars, time, and energy will have the most impact. If you care about making things better, not just talking about it, then data isn't optional, it's essential. It helps remove guesswork. It replaces vague ambition with measurable action, but data without urgency is just information. It's only when we combine what we know with a deep sense of responsibility that change happens. One of the biggest risks we face is becoming comfortable with slow progress, because the numbers can be deceiving. If maternal mortality drops by 10% globally, that sounds like good news, and in many ways it is. But if that same number hides the fact that some regions saw no improvement at all or even got worse, then we're not really solving the problem. We're just shifting it. Urgency in this context doesn't mean panic. It means clarity. It means looking at the numbers that matter. How many children won't finish primary school this year? How many families will drink unsafe water tomorrow? How many tons of carbon will emit this week? And understanding that every delay has a cost, not in theory, but in real lives, real futures. Every month, a proven intervention goes unfunded. Every quarter, a pilot project stalls. Every year, we postpone climate adaptation plans. That's opportunity lost, and in many cases, it's irreversible. That's why I'm focused on setting deadlines that feel ambitious but possible. The 20-year horizon I've set to give away the vast majority of my wealth isn't about a symbolic gesture. It's about creating momentum, about pushing resources into action while they can still make the biggest difference. I don't want to wait until the next generation to tackle the hard problems. I want to see what we can achieve now in our lifetimes with the tools and insights we already have. Some of those tools are improving faster than even I expected. In global health, for instance, mRNA technology, originally developed over decades, proved during the pandemic that we can go from discovery to deployment faster than ever before. In education, adaptive learning platforms are helping students in underserved communities master foundational skills at their own pace. In agriculture, digital sensors and satellite data are guiding smarter planting decisions that improve yields and reduce waste. These innovations, backed by data, are not distant ideas. They are already changing outcomes for millions. But again, the question isn't just do we have the tools. It's will we move fast enough to apply them where they're needed most? And that's where urgency must meet coordination. We need better collaboration across sectors, between scientists and policymakers, between funders and frontline workers, between communities and the institutions that serve them. Progress doesn't just require resources. It requires resolve. Every time I look at a chart showing under 5 mortality, I think of the faces behind those numbers. Every time I see data on educational outcomes, I picture the classrooms I've visited around the world. Some thriving, some still waiting for books, electricity, or trained teachers. Data can feel cold, but when it's tied to real people, it becomes a powerful call to action. I'm convinced that the next chapter of progress will belong to those who can move quickly, think systematically, and care deeply. Those who know how to read the numbers and how to see the lives inside them. If we combine our knowledge with urgency, if we treat the future like something we're responsible for, not just something we inherit, then we can achieve far more in the next 20 years than we did in the last 50. This is not about hope alone. It's about action rooted in facts. It's about having the humility to learn and the courage to act before time runs out. In 2045, when this deadline arrives, I don't want to look back and say one day I wished I'd given more. I want to stand with my fellow citizens of the world and say we acted, we seized the moment, we applied our privilege to our potential, because at the end of the day, it's not about how much wealth we accumulate, but how urgently and generously we deploy it. And I'm excited to do just that with all of you alongside me. Thank you.